today's topic is diuretic agents, and diuretic agents are used for the treatment of uh, many diseases. So there is no any particular disease of the kidney, but instead there are many other diseases that are uh, connected uh, to the edema or to the metabolic states. So, and that is why there are so many uh, diseases that are treated with the diuretics. So we already are familiar with the types of the uh, diuretics. So they are classified according to their mechanism of action, and are different types of diuretics like loop diuretic, diazid diuretics, potassium-sparing diuretics, and osmotic diuretics are inhibiting the reabsorption in the different sides of the uh, kidney nephron. And today we are going to focus on the clinical pharmacology of diuretic agents, and this is a table that uh, uh, with the action of the diuretics to the metabolic state and to the uh, ion concentration in the blood, and it shows uh, the influence of diuretics to the concentration of the sodium chloride, uh, sodium carbohydrate that influences the pH and the potassium too. So, and as well as the body pH. These are the vital signs that will influence the adverse effects, which also can precipitate some of the adverse effects, and that is why it should be monitored during the treatments. So, and the first diseases that are treated with diuretics is edematous states, and this is the most common reason for the diuretic prescription, and that is usually include the peripheral and pulmonary edema. Pulmonary edema is particularly dangerous because it can result in death, and usually the edema is the result of uh, the congestive heart failure or the renal or vascular disease that will eventually decrease the so all three of these will eventually decrease the blood flow to the kidney, and the kidney will recognize this reduction in the blood flow, and then will compensate by uh, increasing the reabsorption of the sodium and water, and that will increase the blood volume and uh, eventually lead to the edema. And usually when we prescribe the uh, diuretics, they will sorry they will mobilize the interstitial edema uh, without significant reduction in plasma volume. But if we use the diuretics for a long time, that will reduce the uh, volume of the blood, and then will actually increase the kidney uh, compensation for, for that. So that is why uh, the recent study suggested that it's not recommended to use long-term diuretics administration. But we will get to that later. So the first disease that is treated with the diuretics is congestive heart failure, or CHF. And CHF is developed when the cardiac output is reduced because of the heart failure, and that will decrease the blood pressure and blood flow to the kidney, and the kidney will recognize that as hypovolemia, so as a reduction in the blood volume, and will increase the retention of salt and water. And this is directed to the increase in the blood volume, so that increases the blood volume, and the venous return to the heart is also increased, and that will restore the heart output. So that will compensate the congestive heart failure. So, and then heart failure becomes the compensated. Unfortunately, the heart failure is will still be there. So, um, and the that usually leads to the overload of the heart and further decrease in the output, and then kidney continues to retain salt and water, and then this salt and water goes to the vasculature and becomes interstitial or pulmonary edema. At that point, the disease is will be uh, uh, at the highest point. So the uh, and we are required to prescribe a diuretic to reduce the accumulation of edema, especially in the lungs, because pulmonary edema is dangerous. And the diuretic will reduce the pulmonary vascular congestion and will improve oxygenation, and that is why will improve the uh, cardiac function. That also will lead to the reduction of preload, and that will reduce the size of the heart, and a heart will work in a more efficient manner. And usually for the treatment of the uh, edema from the congestive heart failure, loop diuretics are used because they are most effective types of diuretics, uh, and usually other diuretics are not effective. Sometimes they are combined with the potassium sparing diuretics to reduce the potassium loss, but mostly loop and also with the thiazide. So when there is no enough uh, effect, but mostly loop diuretics are used for the treatment of uh, congestive heart failure. Uh, and the and diuretics will lead to the metabolic alkalosis, and then and they will also reduce the volume of the blood, and that leads to the uh, precipitation of arrhythmias in the heart. So that is why usually the patients should be treated with the potassium uh, replacement drugs, and also the volume of the blood should be restored uh, with the saline. And but unfortunately, in case of the severe heart failure, that is not allowed because the potassium and saline will increase the blood volume and increase the heart, the load to the heart, and that is why uh, sometimes the acetazolamide is used to correct the alkalosis. And so the second adverse effects is the hypo. So the first was alkalosis. Second is hypokalemia. So the reduction in the uh, potassium, uh, and so alkalosis first, and then potassium reduction, and that leads to the arrhythmias, and also increase the digital toxicity. And usually this is avoided by reducing the sodium intake while taking diuretics, because sodium decreasing sodium will de decrease the potassium secreting collecting tubule activity because they are co-transported. So the potassium goes the lumen, and the sodium is reabsorbed. So if there is no sodium for reabsorption, then the potassium will not go to the lumen, and then will be not so will be keep keep it in the body. But not all patients like a low sodium diet, because the food will be tasteless. So like have you ever tried to prepare food without a salt?
Yeah,
So what do you think about the taste?
not good.
Not
We
good.
need salt.
So that many patients will tell the same. So that is why they will not accept this. So so for those patients, uh, um, we have a potassium supplements. So or we can also use potassium sparing diuretics. Together with the loop diuretics, we prescribe a potassium sparing diuretics, so they will increase the potassium. So compensate the loss of potassium with the loop diuretics. So this was the heart failure. So like you see, the if you study pharmacology, you also have to study cooking.
Yes,
So if you have,
sometimes.
and also when you like uh, before, like now it's not true, but before, like 15 years ago, to become a pharmacist you're also required to have some cooking skills to prepare the uh, uh, some some types of the drugs. But now actually,
Just one. I know now it's just one pharmacy in Kazan preparing medicine.
oh, I know, it's like I mean, one type. So there are types of the drugs, like the uh, suppositoria, and so the the candles, and also I think some pills are also made by hand, so you have to making them by hand the same way you make a duck. So uh, and so the same tools are used. So anyway,
Mm,
so the second
mm,
disease,
understand.
sorry.
I understand.
Oh, I see. Okay, good. So, and that is why uh, traditionally most of the pharmacists are female, not male, because males they cannot prepare uh, they cannot
Yes.
cook. So, because in like most in here in Russia, uh, the cooking is usually uh, for the woman rather than the man, unless it is a like some chef or working in the restaurant chefs or so at home usually it's for the female. So and then the second disease is a kidney disease and the kidney failure and because the kidney plays a vital role in the volume hemostasis, it's very important for the uh, body. And the most rare kidney disorders will lead to the salt wasting, and some uh, will also lead to the retention of salted water. Uh, the thing is, when the kidney failure is severe, that when the glomerular filtration rate is less than 5 milliliters per minute, the diuretics, even loop diuretics, will not be effective. So the most uh, uh, potent type of diuretics will not be effective because the glomerular filtration rate is insufficient to generate the response. So, uh, like if there is nothing that is filtrated, we cannot reduce reabsorption. So first it should be filtrated. But most of the time, the glomerular filtration rate is not much severe, so it's mediocre, and that is why patients can be treated with diuretics. Uh, Even the patients that are on artificial diuretics. Uh, and many glomerular diseases are associated with the diabetes mellitus or systemic lupus erythematosus, and they exhibit renal retention of salt and water. The It's unknown what is the reason for that, but it's suppose that the renal microcirculation is involved, and uh, diuretics can be effective uh, to reduce edema and hypertension in these patients. Uh, Most of the time, hyperkalemia is seen, especially in diabetic nephropathy in diabetic nephropathy patients. And in these cases, thiazide or loop diuretics will be effective by reducing the potassium, the potassium level in the blood by increasing the secretion of potassium uh, to the uh, creatine tube. And uh, patients with renal diseases with the nephrotic syndrome or often have problems with the volume management, and this this is very often patients may uh, ex- uh, feel the reduction in the plasma volume, and that decreases the glomerular filtration rate and may lead to the orthostatic hypotension. Uh, and In these cases, um, diuretic can be used to control the volume dependent component of hypertension. And In patients with kidney disease, the acetazolamide should be avoided because it causes sodium carbohydrate uh, excretion and can lead to the acidosis. Potassium-sparing diuretics may cause hyperkalemia, and diazide diuretics uh, may be not effective in patients with a low glomerular filtration rate, so loop diuretics are preferred. Uh, but diuretics can be used in combination with the loop diuretics to decrease the dose of the loop diuretics. Uh, so, uh, because furosemide, for example, the most potent loop diuretics in high doses can be pretty dangerous. So uh, that is why combination with a low dose furosemide up to about 5 15 milligram per day instead of 500 milligram per day, which may be advised. Uh, and Also, osmotic diuretics are contraindicated, uh, and uh, uh, and mannitol, that is osmotic diuretic, are only useful in the management of hemoglobin urea or myoglobin urea, and actually there is no any other indication for mannitol. So uh, that is uh, so we have little bit time. So the next disease is hepatic cirrhosis. That is a liver disease associated with edema and ascites in conjunction with elevated portal hydrostatic pressure and reduced plasma on pressure. Uh, the uh, when these symptoms become severe, uh, the diuretics can be very useful. Uh, Unfortunately, loop diuretics may be not effective in these patients because the diuretic is not secreted into the tubular fluid, and there are high aldosterone levels. But fortunately, the spironolactone and eplerenol potassium-sparing diuretics are very effective, and they are very useful in combination with the loop diuretics. Uh, and uh, and they also can be used during the heart failure. Uh, but should be used with a caution because can lead to the depletion of intravascular volume, hypokalemia, and metabolic alkalosis. So the next disease is idiopathic edema, and idiopathic edema is a syndrome most seen in women, and uh, the pathophysiology is unknown, and spironolactone is usually used for the treatment, and uh, so the one of the methods for the treatment is the use of the compression stockings, but it is unknown if they are benefit or not. So I'm not sure, although I think you asked about that before, right?
Yes.
So actually, uh, in case of the edema, so you can also use the spironolactone. Uh, but stockings are like it's unknown if they are uh, beneficial just uh, or just the cosmetic. So I think most of the time they are not effective. So but many women are, especially of your age, uh, at the risk of development of the uh, edema, also idiopathic edema, and the reason is unknown. Unfortunately, for men, it is also will reduce the uh, attractiveness of the leg. So that is why women are very uh, anxious about that. But as I told you before, the prophylaxis is very uh, important here. So the walking, running, any other physical activity is recommended. So then we switch to the non-edematous state. So the diseases without edema. So and the first disease is hypertension. And you are already familiar with the hypertension. So uh, the diuretics are useful in the treatment of the hypertension, and most of the time thiazide diuretics are used, like hydrochlorothiazide, clothalidone, and clothalidone is long acting, and that is why it's more effective. And usually loop diuretics are not used unless the emergency and heart failure. Uh, and usually the restriction in the sodium intake can uh, can increase the efficiency of the diuretic and uh, uh, and it's nowadays it's not yet so there is no so some physicians prefer to use thiazide diuretics, others prefer not to use and anyway patients are now treated with thiazide diuretics just as monotherapy and uh, and the results are that targeted diuretics are as effective as the angiotensin converting enzyme inhibitors or calcium channel blockers, and that is why more and more physicians now prescribe targeted diuretics, including chlortalidone, for the treatment of the uh, hypertension, especially in the elderly. Uh, so and also they can be used together with the angiotensin converting enzyme inhibitors and also with the hydralazine and minoxidil uh, as because so the latter drugs will uh, lead to the significant salt and water retention because of the vasodilation. So the direct vasodilators like hydralazine. So the next disease is nephrolithiasis, uh, and is connected with the calcium and uh, the calcium that is stored in the kidney contains the phosphate or oxalate, um, and uh, and they can lead to the formation of the stones, and that will decrease the proximal tubular calcium reabsorption. It is usually treated with the target diuretics, which enhance the calcium reabsorption in the distal convoluted tubule, and that will lead to the reduction in the urinary calcium concentration. So there are no stones in the uh, 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 there are no stone formation, and also patients should increase the fluid intake and reduce the salt intake because increased sodium chloride will uh, decrease the hypocalciuric effect of TSIs. Uh, it is not recommended to decrease the dietary calcium level because it could lead to the negative calcium balance. And calcium stones may also be caused by increased intestinal absorption of calcium, and it is also treated with the diuretics. So the next disease is hypercalcemia. It is a medical emergency, and loop diuretics are used for the treatment of this disease. Uh, and Because of the reduction in the blood volume, saline must be administered simultaneously. So and usually normal saline and furosemide are administered intravenously. Uh, and Potassium also may be added to the cellar in infusion because loop diuretics will lead to the potassium decrease. So the next disease is diabetes insipidus. Diabetes insipidus is the uh, insufficient production of antidiuretic hormone and or inadequate responsiveness to this hormone. And administration of supplementary antidiuretic hormone or analog of this hormone uh, is effective in sensual diabetes insipidus, and target diuretics can help to reduce polyuria and polydipsia, and lithium used in the treatment of manic depressive disorder is a common cause of uh, nephrogenic diabetes insipidus. Lithium is used for the treatment of the manias. Uh, and also tacit diuretics are effective in treatment of these patients. So with the lithium treated. Uh, and so uh, so I think that is all for today. And if you don't have any questions, Alan, no
Yes,
questions.
everything is clear.
So
No
okay then.
question.
Uh, we are done with the lectures for this year, and we have two classes left. So the next week and a week after, and then we will complete uh, uh, with the clinical pharmacology in this semester. So thank you for your attention and see you at the class next week.
Thank you.
Bye bye.
See you. Good. Thank
Bye
you.
bye.